This is not unusual. When I was in private practice, we would charge what we charge, let's say $100 for a visit, knowing we were going to get 30. Now, when I first went into practice, I said, you know what would make sense? Let's do this. We took our overhead, which was the rent and the electricity and everything else, and then we took the salaries that we wanted to pay for our staff and the salaries we wanted to pay for ourselves, which was minimal at the time. And then we divided it by a hypothetical 25 patients a day. And we said, okay, for a new visit, X amount of money. For a follow-up visit, X amount of money. If we do an EKG, we take in how much it costs to resupply the machine and electricity and stuff. And that's what we charged. And we ended up charging for physicals exams maybe $100, $125. And the insurance companies would pay us between $10 and $15. And then we discovered that if you bill $500, you'll get $100. And if you bill $625, you'll get the $125 for a new visit. And if you bill $300 for a follow-up visit, you'll get the $65 that you wanted for the follow-up. This never made sense to me. Why you need to upcode, why you need to overcharge in order to get a fair compensation in order to pay for your bills as a physician. If you see more patients or if you provide better quality care, no one cares. You could be the worst doctor in the world and you crank out the patients and you overcharge and they don't care. Doctors who took their time and who take their time and who listen and who evaluate you and work through things with you, they don't get compensated for that. So you end up with this huge accounts receivable, which is how much you should be getting based on the charges. Part of built into software is how much the write-off is going to be. So your accounts receivable would be at, $100,000, and you're going to get maybe $1,000. So it's a big shell game by the insurance companies. If you have an HMO, and again, this is the United States, if you have an HMO, the doctor gets, I think it's $14 a month if you're getting a good compensation, or maybe even $20 a month now. And your $2 to $10 copayment makes up the difference. Now, that's not enough to pay for overhead for a doctor's office. So this is why most physicians really would like universal health care, because then reasonable compensation can be done, and maybe even get away from the concept of fee-for-service, and maybe go with a panel and taking care of people for quality care. Got some homework for you. Look up patient-centered medical home. In my opinion, this is where it should all be going.